Great. Well, thank you. And I want to welcome everybody. I know we have a large group from around the country, which shows the importance of the topic that we're talking about, and also the passion that people have in making veterans' lives better. So we thank you for all your service and your attention this afternoon. We have a really great panel of experts, so I'm going to try to introduce them to you and do it briefly because I want to hear what they have to say, and that's where we want to spend most of our time. So first, and I'm looking towards my screen, we have Dr. Jason Sico, who's a neurologist and also a clinician researcher. And Dr. Sico is the National Director of VA's Headache Center of Excellence program, which is out of the West Haven VA Medical Center, which is where I actually trained. Dr. Sico has led the development of the recent 2020 combined Department of Defense and VA headache clinical practice guidelines, which hopefully he'll have a chance to talk to us about. But, you know, his responsibilities are really big. 2 million veterans with headaches, 29,000 cluster headache sufferers in the VA system. Next to Dr. Sico is Dr. Michael Hoffmann, who is the professor of neurology at the University of Central Florida. He's chief of neurology at Orlando's Healthcare Systems, runs one of the largest neuro clinics with 8,000 veterans a year getting care there, and really a true thought leader, somebody I respect a great deal in brain health and innovations in treatment. So thank you for joining us. And certainly not last or least is Dr. David Reese, who is a pain specialist, actually served as a White House pain doctor, which is a very selective position, and currently works at Walter Reed and is a leader in defense health in terms of pain management and refractory headaches. So we have really three superstars with us today. And I'm going to jump right into it. I think the reason why we wanted to focus this particular issue on its impact on veterans and those in the active military is because particularly in this population, we see a higher incidence of headache than you would in the general population. And that's probably part of the reason why each of you focus in these areas. But let me just have you talk a little bit about what you think is the incidence in the veteran and military population, a little bit about how you would describe the problem and some of the issues that you see in caring for this population. Dr. Sico, so I think I'm going to stick with the order. I'm going to start with you and just tell us a little bit about your experience with headache among veterans and a little bit about how you've organized these issues in the Department of Veteran Affairs.